These 5 simple isometric exercises will strengthen your entire body while helping control your blood pressure. Safely, have you ever thought about building strength, improving stability, and managing your blood pressure all at once without needing weights, machines, or even leaving your home? That is the power of isometric exercises combined with proper breathing. Instead of counting repetitions or moving through ranges of motion, you hold a static contraction for a specific amount of time, deeply activating the muscles while triggering cardiovascular responses that naturally lower blood pressure. Recent research has shown that isometric exercises are actually more effective at reducing blood pressure than traditional cardio in many cases. A groundbreaking review published in the British Journal of Sports Medicine analyzed over 270 studies and found that isometric training produced the greatest reductions in blood pressure of any exercise type, with average decreases of 8 points, systolic and 4 points diastolic after just 8 weeks. The best part is that these exercises can be done anywhere, require no equipment, and take less than 15 minutes total. In this video, you will learn about the 5 best isometric exercises capable of strengthening your muscles, improving your posture, increasing your endurance, and most importantly, helping you manage your blood pressure naturally and safely. But before we begin, leave in the comments your name and the city from which you are watching our content. And if you're dealing with high blood pressure, let us know so we can support you on this journey. Before we dive into these powerful exercises, don't forget to subscribe to the channel and turn on notifications, because having constant access to correct science-based health information is what will help you improve your cardiovascular health and strength in the long term. Let's get started. Isometric exercise number 5, wall squat with controlled breathing. The wall squat, sometimes called the invisible chair, is one of the most powerful isometric exercises for both building leg strength and lowering blood pressure. When done against the wall, it concentrates the work on the quadriceps, glutes, and core without requiring any repetitions or equipment. Here's what makes this exercise so effective for blood pressure management. When you hold a static squat position, your large leg muscles compress the blood vessels in your thighs. When you release the isometric position, there's a sudden rush of blood flow throughout your body. This repeated pattern of compression and release trains your blood vessels to become more flexible and responsive, which is exactly what you need for healthy blood pressure. Simply position yourself with your back flat against a wall and walk your feet forward about 2 feet. Now slowly slide down the wall as if you were sitting in a chair, bending your knees at about 90 degrees, and hold that position. Your knees should be directly above your ankles, not pushed forward past your toes. This alignment is crucial because it protects your knee joints and ensures the proper muscles are working. Keep your lower back and shoulders well supported against the wall, avoiding arching your back. Your chest should stay open and your core active, distributing the effort evenly. Now here's the critical part for blood pressure control. While holding this position, practice deep, controlled breathing. Breathe in slowly through your nose for 4 counts, filling your belly with air. Hold that breath gently for 2 counts, then breathe out slowly through your mouth for 6 counts. This breathing pattern activates your parasympathetic nervous system, the part that tells your blood vessels to relax and your heart rate to slow down. The combination of the isometric hold and this specific breathing creates a powerful blood pressure lowering effect. For beginners, holding for 20 to 30 seconds in 3 sets is already a great challenge. The burning sensation in the thighs arises quickly as the contraction is intense. If you start shaking or your form breaks down, that's your signal to stop and rest. It's better to do 3 sets of perfect 30-second holds than one sloppy 2-minute attempt. Rest for 1 to 2 minutes between sets, allowing your heart rate to return to normal. As you progress, you can extend the duration of the hold to 40 or even 60 seconds, but always maintain proper technique and controlled breathing. Do not hold your breath. Try to inhale while lowering into position and exhale slowly while holding, keeping your mind focused on maintaining the position and the breathing pattern until the end of the set time. Holding your breath can cause dizziness and actually spike your blood pressure temporarily, which defeats the purpose. The isometric squat strengthens the stabilizing muscles of the knees, increasing safety in daily activities such as climbing stairs or squatting to pick something up from the floor. It also demands core engagement, which remains firm to stabilize the spine. This combination helps improve posture and brings notable strength gains. Because it is so simple and does not require machines, The wall squat easily fits into your routine. You can do it at home, at the office, or even outdoors. Over time, gradually increasing the duration of the hold can bring remarkable results in leg strength, overall conditioning, and sustained blood pressure reduction. Isometric exercise number 4, the glute bridge hold. The isometric glute bridge is excellent for working the posterior region of the body, especially the glutes and lower back, in addition to engaging the core, and it provides significant cardiovascular benefits when combined with proper breathing. You begin by lying on your back on a comfortable mat or carpet with your knees bent and feet supported flat on the floor, positioned close to your glutes about hip width apart. Then lift your hips upward until your shoulders, hips, and knees form a straight line, and hold that position without lowering. The trick is to firmly contract your glutes and abdomen, keeping your body stable as if it were an inclined plank. For beginners, holding for 20 seconds across 3 sets may be a good start. As you gain strength, progress to 30 or 40 seconds without letting your hips sag. If you feel pain in your lower back, adjust the height. Perhaps you're lifting your hips too much or not engaging your abdomen enough. The idea is to create a straight line from shoulders to knees without excessively curving your spine. In addition, press your heels firmly against the floor, as this helps engage your glutes better and takes pressure off your lower back. While holding this position, maintain steady, controlled breathing. Inhale slowly through your nose, then exhale slowly and completely through your mouth. This breathing keeps your blood pressure stable and prevents the spikes that can occur when people hold their breath during exertion. One of the great benefits of this bridge for blood pressure management is that it improves circulation in your lower body. Many people over 60 experience poor circulation in their legs, which forces the heart to work harder and elevates blood pressure. By strengthening your glutes and activating your posterior chain, you're improving the efficiency of blood return from your lower body back to your heart, reducing cardiovascular strain. The isometric bridge also corrects imbalances caused by spending too much time sitting. Weak glutes can cause lower back pain and compromise your posture, both of which can indirectly affect blood pressure through chronic pain and stress. By strengthening this area, you protect your spine and gain more stability for movements such as walking, climbing stairs, or squatting. The isometric contraction promotes deep activation of muscle fibers that are often forgotten in routine activities. If you want to make it more challenging as you progress, try the single leg bridge, extending one leg straight while holding the weight on one side only. But remember to alternate sides to avoid creating imbalances. However, master the basic version first before advancing. A soft mat or carpet is enough to provide the necessary comfort for your back and shoulders. The principle remains the same regardless of variation. Focus on engaging the glutes, keeping your abdomen firm, maintaining careful alignment, and breathing steadily. In this way, the isometric bridge prepares your body for various activities while supporting healthy blood pressure, all without depending on expensive equipment or gym memberships. Isometric exercise number 3, the modified plank hold. The isometric plank is a classic core exercise that provides remarkable benefits for both muscular strength and cardiovascular health when performed correctly. The principle is simple. Keep your body aligned as if it were a board, resting on your forearms and on the balls of your feet. However, for blood pressure management and safety, we're going to use a modified approach that's appropriate for people over 60 or anyone with elevated blood pressure. Instead of holding a full plank on your toes, you'll perform the plank from your knees. This modification reduces the intensity just enough to make the exercise sustainable for longer holds, while still providing excellent core strengthening and cardiovascular benefits. Position yourself on your hands and knees, then walk your hands forward until your body forms a straight line from your head through your hips to your knees. Your forearms should be flat on the ground, with your elbows directly under your shoulders. Keep your hips aligned, avoiding both sagging toward the floor and excessively lifting your buttocks. Your head should remain neutral with your gaze directed toward the floor between your hands. In this way, you protect your neck and better distribute the load throughout your core. To begin, try holding for 30 seconds in 3 sets. If that feels too challenging, reduce to 20 seconds until you build endurance. The key is maintaining perfect form throughout the hold. A common mistake is holding your breath during planks, but that raises blood pressure significantly and causes early fatigue. Instead, establish a breathing rhythm before you even get into position. Inhale slowly through your nose for 4 counts, then exhale slowly through your mouth for 6 counts. Maintain this pattern throughout the entire hold. This conscious breathing is what transforms the plank from just a core exercise into a blood pressure lowering practice. The steady, controlled breathing activates your vagus nerve and parasympathetic nervous system, countering the natural tendency for blood pressure to rise during exertion. The isometric plank is excellent for strengthening the core overall, while also working the stability of the shoulders and lower back. This muscle reinforcement positively impacts your posture, and good posture actually helps maintain healthy blood pressure by preventing compression of blood vessels and allowing for proper breathing mechanics. With consistency, you will feel improvements in tasks that require abdominal strength, such as carrying objects, getting in and out of chairs, or even maintaining an upright posture for long periods. The progression in time is flexible. Start with modest goals, and as you master the technique and breathing pattern, gradually increase your hold time. This helps maintain steady progression and avoids overloading your cardiovascular system. If done with attention to posture and breathing, the modified plank protects your lower back rather than harming it, as it properly engages all the support muscles. The secret is to distribute the tension throughout your entire body, not letting only your shoulders or abdomen bear the burden. As you become stronger, you can progress to a full plank on your toes, but only after you can comfortably hold the knee version for 60 seconds with perfect form and controlled breathing. Isometric exercise number 2, the chest press hold. This exercise might surprise you because it requires no equipment except your own hands, yet it provides powerful benefits for upper body strength and blood pressure control. The chest press hold is an isometric exercise where you create resistance by pressing your palms together, and it's been shown in studies to significantly reduce blood pressure when practiced regularly. Stand or sit with good posture, shoulders back and down, away from your ears. Bring your palms together in front of your chest at about heart level, fingers pointing upward, like a prayer position. Your elbows should be lifted out to the sides at about chest height, creating a straight line from elbow to elbow across your chest. Now here's where the isometric work begins. Press your palms together as hard as you can, as if you're trying to squeeze something between them. You should feel your chest muscles, specifically your pectorals, engage intensely along with your shoulders and arms. But don't just mindlessly squeeze. Focus on the quality of the contraction and direct all that force through your chest muscles. While you're pressing, this is absolutely critical. Maintain steady, controlled breathing. Breathe in slowly through your nose for 4 counts, hold for 2 counts, then breathe out slowly, through your mouth for 6 counts. Continue this breathing pattern throughout the entire press. The combination of upper body muscle contraction and controlled breathing triggers a relaxation response in your cardiovascular system that directly lowers blood pressure. Start with a 20 to 30 second press, maintaining maximum pressure throughout. After your hold, release and shake out your arms for 30 seconds, then repeat for 3 sets total. As you build endurance, you can extend the press to 40 or even 60 seconds. But remember, the intensity of your squeeze and the quality of your breathing matter more than the duration. A strong 30-second press with perfect breathing beats a weak 1-minute attempt. The reason this exercise helps with blood pressure is fascinating. The sustained muscle contraction temporarily restricts blood flow to the working muscles. When you release, there's a reactive dilation of the blood vessels and a rush of fresh blood into the area. This repeated pattern of constriction and dilation is like a training session for your blood vessels, teaching them to be more flexible and responsive. Flexible, healthy blood vessels mean better blood pressure control. Additionally, the focused breathing and concentration required for this exercise help reduce stress and anxiety, both of which are major contributors to high blood pressure. It's a mind-body exercise that addresses multiple factors affecting your cardiovascular health simultaneously. One common mistake is tensing your neck and shoulders while pressing. Keep your shoulders down and away from your ears. All the tension should be in your chest, not creeping up into your neck. If you feel your shoulders rising or your neck getting tight, take a break and reset your position. Another error is holding your breath during the press because you're concentrating so hard. Remember, that steady breathing pattern is half the benefit of this exercise for blood pressure management. Isometric exercise number 1. The wall push hold. This final exercise combines the benefits of upper body strengthening with powerful blood pressure lowering effects, and it's completely scalable to any fitness level. The wall push-hold is essentially an isometric push-up performed against a wall, making it safe and accessible even for people who haven't exercised in years or who have significant blood pressure concerns. Stand facing a wall at arm's length distance. Place your palms flat against the wall at shoulder, height and shoulder width apart. Your feet should be positioned so you're leaning slightly into the wall. Now, keeping your body in a straight line from head to heels, bend your elbows slightly and lean further into the wall until you feel moderate tension in your chest, shoulders, and arms. You're not fully bent like the bottom of a push-up, but rather holding at about a 45-degree angle. This is your isometric hold position. Hold this position steady, not allowing yourself to sink closer to the wall or push back away from it. Your entire body should feel engaged, from your chest and arms to your core and legs. This total body engagement is part of what makes this exercise so effective for blood pressure management. Now, establish your breathing pattern. Inhale slowly through your nose for 4 counts. Hold gently for 2 counts. Exhale slowly through your mouth for 6 counts. This extended exhale is crucial as it maximizes the activation of your parasympathetic nervous system and the blood pressure lowering response. Start by holding this position for 20 to 30 seconds while maintaining the breathing pattern. Rest for 1 minute, then repeat for 3 sets total. As you get stronger over the coming weeks, you can increase your hold time to 45 seconds or even 60 seconds, or you can increase the difficulty by moving your feet further from the wall, which increases the load on your upper body. The wall push-hold works your chest, shoulders, arms, and core all at once. But, more importantly for blood pressure control, it creates an isometric challenge that trains your cardiovascular system. The sustained muscle contraction followed by release teaches your blood vessels to dilate more effectively. Regular practice has been shown to reduce resting blood pressure and improve vascular function. This exercise is also excellent for people with joint concerns because the wall provides stable support, and you can adjust the intensity simply by changing your distance from the wall. Closer to the wall means easier. Further away means harder. This scalability means you can continue progressing over time without risk of injury. One important safety note: if you feel dizzy, experience chest pain, or notice your blood pressure spiking rather than lowering, stop immediately and consult your doctor. For most people, this exercise is perfectly safe and beneficial, but it's always wise to listen to your body and work within your capabilities. As you practice this, exercise regularly, you'll notice not only improved upper body strength, but also a greater sense of calm and better blood pressure readings. Many people report feeling more grounded and centered after their isometric exercise sessions, as if they've done both a workout and a meditation, putting it all together for maximum blood pressure benefits. Now that you've learned these 5 powerful exercises, let's talk about how to structure them into an effective routine for managing blood pressure and building strength. The beauty of isometric exercises is their efficiency. You don't need to spend an hour working out. Perform all 5 exercises in sequence 3 to 4 times per week. Start with the wall squat, then move to the glute bridge, followed by the modified plank, then the chest press, and finish with the wall push-hold. This order works your body from largest muscles to smallest, which is most efficient for both strength building and cardiovascular benefits. Rest for 2 minutes between exercises, walking slowly or doing gentle arm circles to keep blood moving. The entire routine will take just 12 to 15 minutes, but the benefits for your blood pressure can last throughout the day. Research shows that isometric exercises can keep blood pressure lower for up to 24 hours after practice. If you can't do all 5 exercises in one session, that's perfectly fine. Split them up throughout your day. Do wall squats in the morning, the bridge at lunch, planks in the afternoon, and the arm exercises in the evening. The key is consistency, not perfection. Aim to practice at least 4 times per week, but your body also needs rest days to adapt and get stronger. When will you see results? Based on research and clinical experience, here's what you can expect. Within the first week, you'll likely feel a greater sense of calm and notice improved body awareness. After 2 to 3 weeks of consistent practice, you might start seeing small decreases in your blood pressure readings, typically 3 to 5 points. By week 6 to 8, substantial changes often occur, with many people seeing reductions of 8 to 10 points or more in systolic blood pressure. Track your progress by checking your blood pressure at the same time each day, ideally in the morning before medication. Keep a simple log, and after a few weeks, you'll see the trend. Remember, these exercises work best as part of an overall healthy lifestyle. Continue eating a balanced diet, stay hydrated, manage stress, and get adequate sleep. The exercises enhance all these other healthy habits. The power is in your hands. What you've learned today isn't just a workout routine. It's a proven, science-backed method for strengthening your body while naturally managing your blood pressure. These 5 exercises require no equipment, can be done in any space, and take minimal time. What they do require is commitment and consistency. You can start with just one exercise today. Maybe the wall squat speaks to you because it's straightforward and you can feel it working immediately. Maybe the chest press appeals because it's so simple yet effective. Pick one, commit to it for 1 week, then add another. Build gradually and watch as your strength increases and your blood pressure comes down into healthier ranges. If this video showed you a safe, effective way to build strength and manage blood pressure, please hit that like button and share it with someone who needs this information. Drop a comment letting me know which exercise you're going to start with today. And don't forget to subscribe for more science-based health strategies designed for people who want to take control of their health naturally. I'll see you in the next video.